Miscarriages are definitely a shock for any woman that have experienced miscarriages. And then when it happens, it leaves you with that anxiety of when next am I going to conceive? When will my ovulation come back? Will my cycles be regular again? How do I track my cycle? What does this mean to my fertility? Is my age part of the problem? Was it my fault? My lifestyle? What went wrong? And stuff like that. And we've got a lot of these types of miscarriages, missed miscarriage, and sometimes you hear the sonographer tell you things like an empty sac, blight ovum, late miscarriage, and what have you. So today we are basically going to be looking at all of these things. If you're seeing my face for the first time, my name is Chidima. I'm a registered nurse, midwife, and with my experience in the fertility setting, we talk about sexual health, reproductive health, and every topic that might interest you. Stick around with me. Make sure you watch to the end because you're definitely going to get something from this video. So without wasting so much time, let's get right into it. I'm going to be trying as much as I can to break it down. I'm not going to be using a lot of medical jargons here, just so that everybody will be carried along and understand exactly what we are saying. So the first thing we are going to be looking at is why exactly do miscarriages happen? So the first reason why miscarriages happen, it could just be age. Age is a big factor when it comes to women's fertility. So the younger you are, from 20 to 35, is usually seen as the right age bracket, in quotes, for women to get pregnant and get done with all the things that has to do with childbearing and what have you. And then from 35 and above, you are considered, if you get pregnant, high risk pregnancy and what have you. And it is said that you're going to be having challenges, trying to conceive and all of that, because of the fact that as you're aging, the eggs are also getting older. Your ovarian reserve, which is the amount of eggs left in the ovary, are also going down, because every month when you ovulate, an egg is released and that reduces the quantity of egg that is left. So age is a factor. So with age, the quality of the egg goes down, and even for the men, the quality of the sperm goes down as well. But it doesn't decline like that of women. The women's own just goes down the graph like that. But the man can also have issues with the quality of sperm. So when it comes to all the genetic transmissions, cell divisions, if anything goes wrong because of poor air quality or the quality of the sperm, you can experience miscarriage. So that is one reason. So the second reason why miscarriages happen is lifestyle. Some people are into smoking and drinking a lot, and then that's part of the reason why it happens. So it just does all of those changes that it has to do to your reproductive system, and then throws you into that line of miscarriage. Another reason why miscarriages happen is it's not because of the woman's age, it's not because it's the fault of the woman, it's just because something has gone wrong in the development of the fetus, that is the baby that is in the womb, and then the heart stops beating and your body gets rid of the pregnancy. So these are just a few reasons why miscarriages happen. And I will not forget to say that some people experience it, all the time. Some people have recurrent miscarriages, and it could be as a result of an incompetent cervix, meaning that when this woman conceives, the cervix is not firmly closed, is a little bit open. It could be as a result of D&C and leaving the cervix with scar tissues. It's just like having a wound and then the wound heals, leaving the area with a scar. So that can also make everything that comes in as a pregnancy to go down before the baby is due to be delivered. So this is some of the causes, or these are some of the causes of miscarriages. Now let's look at ovulating after miscarriage. Some people are worried about ovulating after miscarriage. They are worried about the fact that they might not be able to track their cycle accurately anymore. But I'm here to tell you that a woman can actually ovulate, everything, quote unquote, being all right with the organs, your hormones, everything being as it should be. Most women will usually ovulate within 3 weeks or even 2 weeks, 2 to 3 weeks following miscarriages. And that's why you can see that it's easy for some women to take in again after miscarriage, and for some others it's not that easy. So that's that for ovulation. Put it at the back of your mind that your ovulation returns 2 to 3 weeks after you've had the miscarriage, everything being okay without issues, right? So that's that. Now let's come over to the big thing, which is conceiving after miscarriage. Now there are a lot of factors. There are a lot of factors which we consider, and these factors have a long way to go or these factors have a lot to play in how soon a woman can conceive after a miscarriage. Now, some people conceive as early as 2 weeks after a miscarriage if they ovulate at the time, especially if they are much younger. So age again is coming. So if people are much younger and their hormones are intact, it means that they have a chance of conceiving faster enough than an older person, which is why we say that the moment you are up to 35 or 40 and you are desperate about having another baby, make sure that as soon as the blood flow from the miscarriage, usually it will last about 10 to 14 days, as soon as it has stopped and you feel mentally fit, just kickstart trial. Just start trying immediately to conceive, because I mean your age is there and you don't want to waste more time, because research has it that people who try to conceive within the first 3 to 6 months of having a miscarriage have a high chance of conceiving and having a live birth. Remember, one thing is you conceiving and another thing is that pregnancy ending up in a live birth and not having another miscarriage, because there is a direct and indirect chance that if you've had miscarriage before, you might also have it again. And for some people, they may never have it again until they finish their childbearing. So that for conceiving, just put it at the back of your mind that you must have a healthy reproductive system in place. When I say this, I mean all your hormones must be in point. Your body, your brain must be able to stimulate all the necessary hormones, the estrogen, the progesterone, to kickstart work again for your cycle to be all right before you can conceive. Now, if conception has to do with your age or one fertility issue or the other, say you've had an IVF and it ended up in miscarriage, or you have hormonal issues and you have been on hormonal workup plan and then at the end of the day you conceived. Now, this case is different. What it means is that the moment you experience that miscarriage and you're done with, you need to go back to your doctor, because obviously for you to have been on that line before you conceived and it ended up in miscarriage, you just have to go back to your doctor to get your hormones checked, to make sure the prolactin is not too high to inhibit you from ovulating in every cycle you have, to make sure your estrogen, your progesterone, luteinizing hormone, follicle stimulating hormone, all those hormones that have to do with childbearing, your doctor is going to check all of them and make sure that everything is intact, including your thyroid function test, to make sure that your thyroid gland is functioning very well. And now, if you had an IVF and then it ended up in miscarriage, you're still definitely going to go back to your doctor, because they will need to take a tissue. Most doctors will prefer, if a woman is not conceiving naturally and then eventually conceived and ended up in miscarriage, they will prefer you to have that miscarriage process go on in the hospital, so that they can take a sample of the tissues and send it to the laboratory to test and know exactly what has happened. It gives them an idea or a broader view of how to help you conceive again and stuff like that. So that is that. So conceiving after a miscarriage is very dicey. It puts you into a panic. You are worried about your chances. So make sure that you do not put anxiety first. I know it's difficult. Trust me, I'm talking from workplace experience, and I'm also talking from a personal life experience. I've been there. I know how these things can happen. So make sure that you try as much as you can to see it as that is life. That is one of those things that can happen, so that you can relax enough not to let hormones like cortisol be a lot in your bloodstream and hinder a lot of things from going on normally in your body system. So that is that about conceiving. Do you have a high chance of ending up in miscarriage again? Possibly yes, possibly no, depending on your situation. If you conceived naturally, you've never had to go to a fertility clinic to conceive, you've never had issues with your hormones and stuff like that, the high chance, 85% of the time, you are going to get pregnant again and have your baby, have a live birth. But if you've been having challenges, maybe due to hormonal issues, due to structural issues, due to maybe infertility on the aspect of the man, with his sperm quality and all of those things. If you've had any reason, or maybe even tuber blockage and stuff like that, if you've had any reason to be at the fertility clinic, or you're way older, like 40, 45, 35 and above, chances are that conception might be a bit challenging, because at this age, when you are from 35 and above, the chance of conceiving naturally without aid is about 5% in every cycle that you have. That's like in every month. So if you have had to do all of those fertility workup and stuff like that, you might need to immediately, there is no need wasting time. Guys, hear this from me. There is no need, there is no point wasting time whatsoever. Just make sure you go back to your doctor and get your body checked out. Go by the rules per se. That is what I say. Go by the rules. Follow all the instructions they have given you to increase your chances of getting pregnant again. And above all, having a supportive partner. Women, I cannot emphasize this enough. If you have a partner who understands where you are, because trust me, so many men do not understand what women go through when they're having miscarriages, just a few of them. So if you have a partner who is very supportive and who understands that you're going through a hard time, you are usually going to have this process go and be able to carry on with your life, conceive again, have a healthy pregnancy and stuff like that. Because even if the doctor, you go to that clinic and the doctor says, oh, I need to get some sample from your partner to send to the lab to just to make sure that the sperm is healthy and stuff like that, they're not worried. They are more than happy to follow you just to make sure you both are happy, because they need this baby as much as you need it. So that's that, guys. This is where I'm going to end this video. If you have a question or you have any concerns regarding what I've just said, go down the comment section and let me know, and I'll be quick to reply you. And if you want to keep things confidential and you don't want to go through the comment section, you can send me an email and I'll be quick to reply you. I'll see you guys in my next video. Try as much as you can to give this video a thumbs up so that YouTube can recommend it to as many women that are having this phase of their life, so that they can be able to learn as well and be able to handle issues correctly. Again, don't make it your last time coming to the channel. Make sure you subscribe, and I'll see you in the next video. Bye.